Hey, my name's Amanda Painter, Doctor of Physical Therapy, physical therapist, and fitness coach. And today what I wanted to talk to you a little bit about is something that comes up in the clinic a lot for pain that's happening in the front of your knee, either kind of under the kneecap, or a little bit below, or a little bit on top where that tendon is. So at the top of it, it's called your quad tendon. And then it basically, all these quads, the muscles here, the four muscles, they come together, form a tendon. And then they go down and you've got your kneecap kind of sitting in the middle of that tendon. And then they just go a little bit farther down, turn into the patellar tendon and attach to the bone on the bottom. So what's happening is just a little bit of extra stress is usually getting pulled at the quad, and that usually happens from different imbalances that you might have. So there's a lot of reasons that you could have that discomfort, but here are 3 things that you can try to kind of see if they start to help you out. I recommend doing 30 of each. If you need to take breaks, go ahead and do that. Do it every day for about 2 weeks and see how it feels. See if that pain starts to decrease around that knee. If not, I'd recommend following up with somebody. But the first thing you can do is lay down on your side, and you're gonna keep your heels and your hips. I'm not gonna roll back, I'm not gonna roll forward, I'm just gonna be on my side, and I'm just gonna open up my hip as far as I can comfortably go. If I go too far, I'm gonna start to roll. So you wanna stop before that roll. So this is the first one, and this is called a clam or a clamshell. The second one is similar. You're gonna lay on your side, same position, keep that bottom leg in that same spot. Top leg goes straight, and pretend there's a wall behind you. If you want to do this against a wall, you can put your back and your butt against the wall, and you're trying to keep your leg, your heel sliding against the wall. If you end up seeing your toes when you look down, then you've lost that form. So keep your hip back, and then you're just going to go up and down. And again, just go as far as is comfortable. If this bothers your back, just don't go as high. If it bothers your knee, go ahead and stop. It just means that there's extra stress on that inside of that knee, and you want to take the pressure off of that, so just go with the clamshell. So those are 2 exercises you can try. The other one is standing, and I'll attach onto this video. All right, so for the standing part, you're gonna want a band. If you've got a longer one, you can go ahead and tie it into a knot and make it small. You're trying to go for about the bones in the front. That's how big this band is. You're gonna go ahead and take the band, put it around, and go right above the knees. Then what you're gonna do is stand on one leg. Don't let your hip jut out. Think about standing nice and tall. You're gonna take your other leg, bend at the knee, and you're gonna go at like a 45-degree angle straight back into the side. So I'm gonna go at an angle. So not straight out here, not straight back, but out to the side. So 45-degree angle back. Again, don't let that hip jut out. Think about being nice and tall. If you need to do this holding on to something, go for it. Do this on both sides. You might feel it in the leg that's moving, but you should really feel it kind of here on the leg that you are standing on. So go ahead and give those a shot. If you've got questions, let me know. Feel free to post in the YouTube section below, and I hope that starts to help with some of the pain you're having.